Hello, I'm Ditya Shalda, currently studying BMLT in AIMS Kalyan. So back after long days, exams was there and some staffs all there, so couldn't make videos. So now today got time to make some videos. So let's start. Today we'll be discussing about ESR. It will be a brief and short video, just the information: what is ESR, what is the normal value, what is the methods, why ESR is important. That's all. So let's start. So ESR. So what is ESR? Let's start with the full form of the ESR. So ESR full form is erythrocyte sedimentation rate. So first we can, if we go to the definition, we can decode it by the full form also. Erythrocyte. What is erythrocyte? Erythrocyte means the red blood cells. Sedimentation rate, the rate at which it sediment. Now come to the definition. It is the rate at which red blood cells sediment in a period of 1 hour. So as it is called rate, so we have to calculate it in some time. So we are calculating the sedimentation rate per hour. So it is the rate at which red blood cells sediment in a period of 1 hour. That is ESR. Now what is the mechanism of that sedimentation? Why erythrocyte sediment? If we first think about it, there is a, in simple language, there is a positive force and a negative force which are balanced, and then it is not sedimenting in our blood. So we are doing, in the sedimentation, something is going on, for that balance is disturbed and erythrocyte is sedimented. So now come to the language. ESR is governed by the balance between pro-sedimentation factor and those factors which are resisting the sedimentation. So there are some factors which facilitates the sedimentation, and there are some factors which resist the sedimentation. So pro-sedimentation factor means that helps in the sedimentation. So what is this? This is fibrinogen. And if we check that what factors resist the sedimentation, that is the negative charge of the RBCs. Every RBC has a negative charge on their surface. That is also known as zeta potential. So ESR depends upon the difference in specific gravity between red cell and the plasma. Also is greatly influenced by the extent to which RBC from the rouleau. What is rouleau formation? Rouleau formation means it is the clumping of RBCs in the shape of some coins. If we collect coins and make it a column like structure, that shape is known as rouleau. Rouleau formation is a phenomenon where RBC clump together to form stack that resembles columns of coin. This rouleau formation is very important for erythrocyte sedimentation. This is very important factor is rouleau formation, mainly controlled by plasma concentration of fibrinogen and other acute phase proteins like C-reactive protein, haptoglobin, celluloplasmin. Rouleau formation is enhanced by increased concentration of plasma immunoglobulin. So plasma immunoglobulin means antibodies. When the antibody will be increased, rouleau formation is enhanced. So from that we can tell that pro-sedimentation factor helps in the sedimentation, and negative charge of the RBCs resist the sedimentation. So what is the negative charge of the RBC is called zeta potential. So if zeta potential is decreased, that will promote the rouleau formation and hence raise the ESR. Now if we come to the normal value, the general normal value is 4 to 14 millimeter per hour for men and 6 to 20 millimeter per hour for women. There is a general question that comes, why this value differs in men and women. So why this value differ? There are some hormonal factors that influence in the fibrinogen, that influence in the erythropoiesis. RBC numbers differ in men and women. Those factors control this value. Now come to the methods of estimation. There are three methods: Westergen method, Wintrob's method, and the Landau method. Westergen method and Wintrob's method are used. Landau method is not accurate. That is used in the past, but now it is not used. Westergen method is the widely used method. Okay, so Westergen method using Westergen pipette. So what is Westergen pipette? This is known as Westergen pipette. Why it is called pipette? Because in this tube both ends are open. So the tube having both end opened, that is called pipette. Now what is the description of this Westergen pipette? It is 300 millimeter long, of which lower 200 is graduated and upper 100 meter is ungraduated. The diameter is 2.5 millimeter. So we put the blood into it. So before that, anticoagulant has to be used. So what anticoagulant used? Anticoagulant used is 3.8% trisodium citrate solution. EDTA mixed blood is also used in modified Westergen method. What will be the ratio for ESR with this trisodium citrate solution? So that is 4:1. Now come to the method or procedure. 0.5 ml of that citrate solution is taken in the test tube. Then 2 ml of venous blood is mixed with this anticoagulant immediately with the help of syringe. The sample is well mixed. Now the anticoagulated blood is drawn up into the Westergen pipette up to 200 mark. The pipette now set exactly vertically in a Westergen strand. A syringe clip placing on the top and a rubber piece is locked. At the lower end, hold the pipette, the Westergen strand. Now the pipette in the rack, which is vertically placed, is kept in the room temperature without any vibration and exposure of sunlight. Now after 1 hour, the upper level of the RBC column is read at the end of 1 hour. The value that will be measurement in the millimeter is the value of ESR. So what are the stages of sedimentation? Stages of sedimentation. First, rouleau formation, then formation of fine threads by protein, third, rapid fall of protein network, and packing of red cells. Every step has its own time, as we are measuring in the 1 hour. So rouleau formation is the first 15 minutes. First 15 minutes is rouleau formation. Next 15 minutes we can calculate the formation of fine threads by protein. Next 15 minutes rapid fall of the protein network, and last 15 minutes is packing of the red cells. These are the stages of sedimentation. So till now what we have read? What is ESR? Normal value of the ESR. Mechanism of the erythrocyte sedimentation rate. What are the stages of sedimentation, and come to the method. So in method we have learned Westergen method. This is the description of Westergen pipette. What anticoagulant is used, what is the method,